And welcome to the Kiosk Presents. Today we have a great interview with Dr. Robles, Professor of Clinical Education at the University of Southern California, and Dr. Silverberg, Clinical Professor of Dermatology at Columbia. Thank you so much for joining us today.
Thank you for having us.
Thank you for having us, Steve.
All right. Now, I know with school starting in September, there's a lot of kids going back to school, and one common problem is head lice and being able to deal with it. What are some of the risks? What are the main causes that cause younger children to get it or exposed to them?
Well, that's a great question. There are an average 6 to 12 million cases annually in the United States of head lice, and they're usually in children 3 to 12 years of age. And they can be a very difficult to detect at first, but they usually present with itching or little presence of lice or nits, little eggs on the back of the scalp on the hairs. One of the ways that children contract this is just by normal activities. So just playing together, children can certainly catch the infestation. But we also know that children sometimes do things like sharing hats, combs, brushes, or pillowcases, and that can increase the risk of infestation. So we want people to be a little bit careful about those kinds of activities, and there's a little helpful checklist on the Educational Initiative website, which is expertadviceonlice.com, which kind of goes through some of the things we need to address in our household and some of the different treatment options that are available, which you can discuss with your healthcare provider.
How are schools specifically handling head lice on children?
That's another great question. We ask our parents to notify us immediately if they find that their child has been infected, so that we can contain the spread. So that if a classroom of a child comes in second grade and has lice, then we will want to know to check the students in the classroom and also send a letter home to parents and probably in the entire school, just to make sure in case they're older brothers and sisters, because we can get ahead of it by notifying parents immediately, and also reminding our children not to share their caps and their hats and also brushes, but also to check what we're doing in school to make sure all our mats are clean and that we look at anything that we are asking children to share. The campaign Headfirst Expert Advice on Lice is really getting that message out to schools right now. That's our effort to really inform parents about what to do, and also schools. The website that was referred to earlier, Expert Advice on Lice, provides not only information for parents and caretakers, but also a website that schools can now send out to their parents as well, to inform them about the proper treatment and also to notify them immediately so that we can get a handle on it. We still, may check with little, sticks to check, but really it's informing us immediately is what we ask parents to do.
Well, what treatment options are available should your kid get the infestation?
Well, there are three aspects to treatment. The first is to contain the spread, and then which we've discussed already. And there are different kinds of shampoos or rinses that are available either as over-the-counter or prescription products. And most of the products that are available, or what we would recommend to patients, are FDA-approved products that are considered safe and effective. And I think it's important to discuss with your healthcare provider which treatment option would be best for your child. But you can also use the information from this website as to inform you as to what's available, so that you can have a really educated discussion with your healthcare provider.
What's the most important thing you want parents and teachers to take away from this interview?
Well, that there's a great resource for parents. Part of this campaign is Expert Advice on Lice.com is a great resource for parents and for schools that provides more of the information that we just shared with you today.
In more explicit detail, of course.
Yes.
Okay, fantastic. So you can check out expertadviceonlice.com. For everyone in Buffalo, Western New York, we have so many schools in the area. There are so many children running around, which is great, but it means that more kids are exposed to not just the cold and the chicken pox and all that stuff floating around, but also something as seemingly, I can admit, gross as lice. And you making sure you catch it early and get rid of it quickly is going to make everyone feel a whole lot better.
Definitely. Thank you so much.
Thank you for joining us here on the Kiosk Presents.
Thank you, Steve.